Hi there and welcome back to another one of our video series. It's Tim here, the online physiotherapist, and today we're going to be looking at the 7 most common types of low back pain. Now, the statistics tell us that 90% of people throughout their lifetime will experience low back pain. And for many people, this keeps coming back and back. So what we want to do is to educate people as to what are the most common types of low back pain, how to treat that with some general advice, and also how to bring that figure down, how to prevent low back pain. So the first type of common back pain is muscle strain or ligament sprain. And this is caused predominantly by prolonged sitting and then getting up and doing our normal activities. So we create a weakening where we're sat for a long period of time. There's a muscle imbalance that's going on, there's tightness going on. And then we get up and we go and lift items, we go and pick up the kids, we go out running, playing our sport, and we wonder why our backs are in agony. So what we need to do is to know what areas of our body are tight, are weak, and then how to tackle that and how to prevent this a muscle strain or ligament sprain coming on. Now, the second type of common low back pain is a lumbar herniated or prolapsed disc. So in between each of our 33 bones in our back, we've got donut-like discs, okay? And inside this donut is some jam. And what happens when we bend forwards and try and lift something up, and then we twist as we go, what happens is that this disc is squeezed. And if it's squeezed in one direction and then twisted, then that jam can just squeeze out. And that is called a herniated or a prolapsed disc. And this can impinge upon your spinal cord, causing significant neurological damage. But it can also just cause some irritation of the nerve, causing pain down the backs of the leg, causing sciatica, and many other issues such as foot drop as well. So the third type of low back pain is a degenerative disc. And this is imagining if you're sat for a very long time, just over a period of years, through that loading of your joints, then the size of the disc is decreased. So it's imagining that donut just decreasing. And so now what we're facing is a bit of an issue, because that's going to cause you back pain, because these intervertebral discs are good at shock absorption and good at just preventing that pain of those bones pressing together. And so we've got quite a flat disc now, which is ultimately going to cause you a lot of pain, and the muscles around that joint and that disc are going to really have to work much harder to support it. So the next common type of issue here is a facet joint dysfunction. Now, facet joints are essentially cogs either side of the main protruding bone that you might feel in your back. And ultimately, these can become locked, they can become strained, and that can be, again, another major issue, and the muscles around it are just going to have to work super hard to try to protect what's going on there. So physiotherapy is really, really useful. We can provide a number of different techniques to just help release that facet joint. Now, another type of dysfunction is a sacroiliac joint dysfunction. Now, this is common in people who have, in women who have given birth, because of that pressure that's going down through. The sacroiliac joint is at the base of the back. So underneath your kind of gluteal crease, underneath kind of that portion by your buttock, that is your sacroiliac joint, or the SI joint. And in terms of how physiotherapy can help that's a lot around strengthening and stretching out those correct muscles as well. Now, the sixth type of common back injury is arthritis. Now, arthritis is a dreaded word, one in which we just don't want to know about, but ultimately we are told about whether we like it or not. Our body tells us that we are in pain because there's an inflammatory issue going on, the arthritis, the wear and the tear around our spine. And this is something which I'm eager to tell you about, because this is something we can work hard to avoid. So this takes time to come on. And so if we tackle things early by strengthening the core, by looking after our ergonomics about how we're sitting, and all of these things, then we can go a long way to preventing arthritis. Even if it runs in your family, we can look at making a stop to that. Now, the final common back pain issue is sciatica. So we mentioned this earlier in terms of a herniated disc can lead to sciatica. But there are many other issues that can lead to sciatica, such as a tight piriformis. The piriformis is deep within the buttock area. And if that's tight, that can squeeze on our sciatic nerve. So there are the 7 most common types of back pain. So if you've got any questions, any comments, then hook us up in the comments section below. Get in touch with our physios on our physiotherapy page, and we can sort you right out. So I hope that's been really helpful for you today. If you think that somebody else would benefit from this video, then of course do please share it. You can subscribe to our channel where we're going to provide more and more content for you to help you go from that world of small pain and less function into a world of more function and less pain. So thanks so much for joining us today, and we really look forward to seeing you another time soon. Take care.